The following episode of the Maui Chamber of Commerce's Business Matters radio show was originally broadcast on October 5th, 2021.
Aloha and welcome, Maui, to the Maui Chamber of Commerce's Business Matters radio show, sponsored by Mokulele Airlines. I'm your host, Pamela Tumpop, president of the Maui Chamber of Commerce, and today we're going to talk about where we're at with COVID and reopening, and look at what others are doing in other regions with the health pass. We're going to talk about individual island mandates and recovery efforts, and discuss possible eases on restrictions given the current status. We're going to have a statewide update on restaurants and how they're handling the different mandates, how the Hawai'i Restaurant Association's reaction to and comments on Governor Ige's message of August 23rd, asking visitors not to travel to Hawaii, and more. And we're going to hear from Sunshine Helicopters, a long-standing chamber member, and how they've adapted through this pandemic. But first, it's my great pleasure to welcome Lieutenant Governor Josh Green. He is a local physician, husband, and father of two, and has dedicated his life to caring for Hawaii families. He began his life's work as a family and emergency room physician in rural hospitals and clinics on the Big Island in 2000. He was later elected to the Hawaii State House of Representatives in 2004 and the Hawaii State Senate from 2008 to 2018, when he was then elected lieutenant governor. He was named the state's COVID-19 liaison and has been a leader in helping to curb the spread of the coronavirus in Hawaii. Good morning and welcome back, Lieutenant Governor Green. How are you this morning?
Thank you, Pamela. Please call me Josh, and I really appreciate being on your show. I'm doing okay.
Thank you. My pleasure. Thank you. I will call you Josh. Thank you so much. Let's talk about the individual island mandates. How do you feel the different county mandates are going and helping with our recovery? And are there elements of some of the individual plans that you feel should be broadened and be used statewide?
Well, I appreciate the question. So mandates have been a challenge for some, and I want to recognize that. My overall approach, my personal approach, has been to encourage people to get vaccinated, which I do support vaccination through the science and just through the demonstration that being vaccinated decreases your risk of getting very sick. That's the doctor in me, right? Very few of our hospitalizations have been amongst those who are fully vaccinated. 85% to 86% of all of our hospitalizations have been for people who are unvaccinated, and 98.5% of all the deaths, tragically, are when people are not vaccinated. But as to mandates, I've really not been the force behind those because I do know that we've got some challenges. One is that our workforce challenges are pretty profound. Right. The mandate should have more likely been a mandate on getting tested, that if you choose, and people do have to make a heartfelt choice about whether to get vaccinated or not, if you choose not to be vaccinated, then you get tested. That's where the mandate probably should come in, that you're tested so that you know that you're not an asymptomatic carrier of COVID and spreading it. There's lots of reasons for this. One of them, which I really explored on Maui when I had the luxury of talking with people who had different beliefs than I do. With Mayor Victorino, he hosted a talk story where he and I listened to a lot of people from Maui, and I heard them. I mean, some people just aren't there psychologically to get the vaccine, but they don't want to spread COVID either. They just want to see their children play sports. They want to go to work and so on. They are having a modest positive impact, if I can be direct. I mean, you do get less spread when you have more people vaccinated. Right. That is true. But you have to thread the needle because right now it's very hard for people to bring back their workforce. We went through a devastating downturn because of a lack of tourism, a lack of the whole industry being active and travelers. As we balance that and have this other variable, it was hard. I think that overall you are seeing a decrease in the number of cases because Hawaii has gotten to a place where two things have happened. One, we're now over 90% for those who are eligible getting their vaccinations initiated. And two, a lot of people in the last 2 months caught COVID that were not protected, and now they have natural immunity. So that combo has meant that our numbers have plummeted, and we've gone from a month ago positive rate of 7.2% all the way down to 3.5%. We went from 11,200 active cases to 4,200 active cases. And as you know, our hospital numbers have dropped from a peak of 448 back on September 3rd down to 178 yesterday, and I can tell you I'm seeing the numbers come in right now, and they're going to be probably down closer to 155 today. So they do work, but they also have to be balanced against what they do to society.
Right. Yeah, I'm really glad that you mentioned that, and again, it is this time where we've kind of, the rubber's hit the road. We've got people who just don't feel it's the right decision for them. We're seeing a lot of businesses work on testing and rapid testing, and even businesses looking at how they can buy the tests in-house and see if they can work with their employees on getting tested there within the business operation. I know that's a new thing that's kind of coming around and being discussed. And how do you feel those rapid tests work in terms of testing for those who just don't want to get vaccinated?
I think that's a very smart approach for businesses and schools and nonprofits and so on. They do work well. In the early stages of the pandemic back last year in May, June, July, the rapid tests were not very accurate, and so we had a lot of false negatives, and that was a concern. But now, with the Binax test and the Abbott ID Now, those tests are very reliable. They're inexpensive. They're about $10 to $12 a pop. They can probably be bought in bulk, I'm sure, and the cost price point can be driven down even further. They're just a very smart approach. And remember, people are still, for the most part, also adhering to mask policies and being careful. So As long as we do those things, you see the case counts drop. Most of this is common sense. Truth be told, we could have stopped the pandemic last year completely in its tracks if, and this is a big if the entire country had committed to 100% mask wearing for 2 months. That would have been sufficient to knock the virus out. But that's a lot to ask from a social standpoint. And also, you're never going to get perfect compliance. And then the Delta variant was very infectious. But if people get tested once a week, if they have some, let's say they're like most businesses where you have somewhere between 10 and 30% of their business, depending on the industry, choosing not to get fully vaccinated, those individuals, you just spend a little extra time focusing on making sure they're very smart about their masking, and they're also, complying with what the management wants, which is to keep everybody safe and healthy for their families. These all tend to be kind of like small families once you talk about the workers, the co-workers, and also for the business itself. You can't have 20 or 30% of the people getting sick or having a lot of spread at, say, a food truck or a restaurant. It's bad for business also. So there's lots of reasons to do it right, and I'm in favor of those rapid tests. People can also even up their game. They can do them every 3 or 4 days if they want. They're just swabs in the anterior, the front part of the nose. They're not nearly as bad as that thing that went all the way back to your brain, so to speak. So, it's a lot more tolerable than it was at first. Some of them even are spit tests, and we used one of those for my 10-year-old when we were traveling. And he was happy as a clam to be able to spit somewhere into a cup and not have to get swabbed.
Well, especially when you go back and watch those old videos and see that swab being put way in the back of your nose. I had that done a couple of times. It's very uncomfortable. So it's nice to know that they're getting more comfortable. For those who maybe haven't had the test, it's nice to know that they're getting more comfortable and also that they're more reliable. I mean, that was one of our concerns. Do you think, given what you just said, and of course we saw this with the state helping to buy PPE much earlier on, do you think the state would help with a large purchase of testing that then could be doled out to businesses or purchased at a much reduced price than people trying to figure this out individually?
Well, the state and the county should do that. We still have significant resources from the CARES Act, and a lot of that is used for testing specifically. So the mayors will each have to make a choice about what they're going to do with their budgets. But yes, it's a good thing because we are coming pretty rapidly to the end of the pandemic. It's not totally over, but at this rate, where each of the 2-week cycles have yielded about a 50% decrease in average case count, hospitalizations, and so on, it's dwindling, and there's less and less risk of a big outbreak. So strategic testing is valued, and it doesn't have to be, we've done like 2.4 million tests statewide for a population of just 1.4 million people. But going down the last, say, 3 months of this pandemic, I think it's completely reasonable to do that. I don't think it should be on the workers. Whenever there's a mandate, quote unquote, I think that then we owe kind of a debt of appreciation to those who participate in it. And therefore, hitting them with the extra, even if it's just $12 a week, a lot of workers, that's an hour wage.
That's
and
right.
that's difficult for them, or it's close to an hour's wage. And so I don't want to see that hit them or the bottom line for the business. Businesses have suffered terribly because of the lockdown. And so government and the monies that came from the tax base really owes it to those businesses, because a lot of bigger industries were able to get the PPP loans, but a lot of small businesses were caught in limbo. They couldn't get loans. They also feel that family obligation to their employees, but it was just impossible to survive. So anything we can do that helps just a little bit, and this is not really that much money, would be, I think, appropriate. But that's a question that we have to, of course, yield to the council and to Mayor Victorino, who I think has been quite generous during this process.
He very much has, and I appreciate you saying that. And I also really appreciate, you talking about, the businesses and their employees as families, because that's what we have here in Maui County is primarily small businesses, micro by national standards, but the business owners, really see them as ohana. And so I'm glad that you recognize that and that they're also hurting. It's not that they don't want to, they don't want to foot the bill. It's that they're struggling to still pay back owed expenses, commercial leases and mortgages and just make up for the losses as they're trying to bring people back. So I appreciate, that realization, because sometimes we don't often hear that. There's a lot of people say, well, it's hard on the employees, and it is, and we don't want to see the employees have to pay for it, and it's hard on the businesses, which is also true. And this would be a great area where we could have government step in and help with some of that large federal funding. So thank you for sharing that.
You bet.
I remember when you were last on, and we were so hopeful over the summer that July was going to be our month, and we thought we were going to see things, rapidly start to improve as at that time, more were getting the vaccination, and we were seeing the counts go up. Given where we're at today, where do you think is the sweet spot? When do you think, given the case counts going down as you just shared and the hospitalizations going down, when do you think we're going to see the restriction ease and we can open up more?
I think it's either in 2 weeks or 4 weeks, honestly. I think 2 weeks, the numbers will likely be sufficiently low. We'll probably have an average case count of about 125 to 150 a day, which is so much lower than where we peaked at 850. Right. And our positivity rate will be well under 3%, which is pretty much considered the national standard for good response. Some people even are okay at 5%, but under 3%, there's really not much transmission. And Maui is doing extremely well. They're in the 2% range right now as of today. So I think in 2 weeks we could very well be there. The governor is somewhat conservative in this area, and it was very traumatic when we got to 448 people in the hospital where they were actually talking about rationing care, something I'm categorically against as a person and a doctor. So because of that, I think he's super risk-averse and doesn't want to risk any slippage. So I never like to predict where the governor will go because I don't have the capacity to make these decisions, of course, as lieutenant governor. But 2 weeks, we probably will be in a safe enough place to reduce restrictions and relax things slightly as long as people are still pretty smart. There's no reason at all right now not to be allowing sports outdoors. That was an appropriate move by Mayor Victorino. There's no question that that's okay, to be outdoors, keeping a little social distance between yourself and others, but watching kids' soccer matches or football matches, fine, completely fine. I think that the larger restrictions as far as gathering sizes or travel, they'll come later. I don't think that there's any reason to rush getting rid of the Safe Travels program. That served us well in general. It's not perfect, but it has served us well. And so that will probably stay on until the end of the year. But I think the largest question is when will we signal to the world that we're okay to have visitors?
Right.
Remember, visitors represented a really small percentage of our cases. It was 1% to 2% total. Now, if we are being honest, when we have a lot of people at work to provide service for visitors, there are more opportunities for the virus to spread between our local families. But now we're vaccinated, and though we intend to reform tourism in a meaningful way and make that footprint less so we can enjoy our lives here more, it's still going to be very central to our economic survival for some time. And that means we have to, at some point, welcome visitors back. So I think that will happen kind of in a robust way come November 1st. The governor is going to need to signal that soon. And because we're protected and because we have the standard that they still are vaccinated at least, if not vaccinated and tested from the international traveler perspective, it will be fine. So I would expect a robust November and December. I really believe that. And I think 2022 is going to be huge economically for us because people are going to play catch-up on their lives. And catch-up in many people's lives means coming to Hawaii, spending 2 weeks here, really recovering psychologically from the isolation that COVID created. And that's going to be good for business. And it's also going to be good because Hawaii will have demonstrated that we are one of the states with the best response. We had, the second lowest case rate and the second lowest mortality rate in the country. And, I'm very proud of that. I'm proud of the people in our state that committed to doing what was necessary to keep these counts down.
Thank you. No, I agree. And I appreciate you sharing that, again, we do need to look at welcoming businesses back. We are very dependent. Of course, Maui County is the most dependent county in the state on the visitor industry. And, we are trying to work with the governor and have that signaling soon and a strong welcome back message given the announcement of August 23rd. And, we understand why he did it, and he's being very cautious. But we've seen a lot of cancellations, and many businesses have seen significant losses as we were entering the shoulder period.
It's very, very tough on businesses. And, most of the economic engine of Hawaii is small businesses. I mean, obviously, we're completely committed to our hotels and airlines and so on. I mean, that's a big part of our employee base. But many small businesses, which have 8, 10, 17 people that work there, they can't survive if there aren't additional people here. We've set a business model, an economic model that depends on, millions of people visiting and embracing Hawaii's culture and some of the special things we have. And it's just not logical to think that suddenly we would, in one fell swoop, move away from that. That would not be fair to all those people who spent 20 or 30 years building their business.
Right.
So we will adjust, and we'll adjust gradually. But for the purposes of recovery, we actually need to restore tourism. And that's what our Safe Travels program did quite effectively. In fact, we're coming up on the year anniversary in 10 days. October 15th, we launched that, and it really worked.
Right.
Again, nothing works perfectly, but note that we had very low case rates because what it did was it put people into a position where they had to go through a thought process about whether it was safe to travel, and they had to get the test, and they had to commit to the reality that if they tested positive, they were going to be stuck in quarantine while on vacation.
Yeah.
So we were careful about that, and in this next iteration, now that we are much, much more protection, and we have kind of like an iron dome over Hawaii, given the fact that 90% of the people are immune in some way or another, we're okay. But I don't want to see people go into November and December, two of the most critical economic months for our state, and not be able to pay their mortgages, to not be able to pay the tuition for their kids, to even many people are, food insecure, that they may only be making $10, $12, $15 an hour. They need to be at work. Yes. And these businesses need to have their workers back. So we should create a climate that's working for them and be sensible. I'm not going to say we shouldn't wear masks. I'm not going to say we shouldn't get vaccinated. Those things are pretty smart. But if we're reasonable and we make some allowances for people who have deep ideological differences, that's what we do in Hawaii. We try to be, when we say we are one Ohana, it's not meant to just be a cliche. It's actually meant to express why we are different than the rest of the mainland. And that family atmosphere, particularly on the neighbor islands, I'm a big island guy, particularly on the neighbor islands, really carries the day.
Absolutely. Well, one of the things you mentioned earlier, and it kind of leads to my next question, you talked about, again, we've had many who are unvaccinated, and they came down with COVID, and we've seen, some of them have been hospitalized. We've seen them be part of that big count that's been growing with the Delta variant. But now they have some built-up immunities, natural immunities. I hear in other areas, like Europe in particular, and in Germany in some regions, that the European countries have gone with something called a health pass. So the health pass encompasses those who are vaccinated and those who have built up those natural immunities because they actually had and came through COVID.
Yes.
Is that something that's being looked at the state level? And, what are medical experts in this country thinking about that kind of health pass, recognizing those natural immunities and allowing the people to travel?
Yes, it is. In fact, we actually have that in place now. It's just not emphasized a lot because if you do test positive for COVID, I mean, if you have COVID, you can expect that you will have a positive test for 2 to 3 months because you'll have viral particles in the upper airways that will still trigger a positive test. So in that circumstance, you're entitled to get an exemption. You get a letter from your doctor and a demonstration that you're 10 days out from having had COVID and you're not symptomatic. So then you get released from quarantine, but we can't expect you to test every week. So then you just need to have an exemption for 90 days. And that is the appropriate thing. I think that we will, and I hope that we will move quickly away from having to need any passes. Once we're done with the pandemic and our state's, immune, I won't say we'll be fully vaccinated, but we have already achieved a great deal of immunity in the background. Then we will not have to worry about this as much. And we do have a commitment from the mayors to drop these safe passes and whatever. I think it's on Oahu, they suggested after 60 days. And we'll hear from them in the coming weeks what that will look like, when they're going to drop that and so on. But if people come into the state vaccinated, which is the standard, we know that they already have met that criteria. And our own people in large numbers have been fully vaccinated. We're talking about, we're just pushing up to 70% of the whole state being fully vaccinated, and we're at 90.3% of the entire population who is eligible, that's 12 years old and older, has initiated it. So there's not many people left that are completely, number one, unvaccinated and or not immune because they had the disease. We've had 80,323 confirmed cases of COVID. All those people have immunity. Some got vaccinated subsequently also. And we know that there's at least another 80,000 to 160,000 people who caught COVID and never tested. So we will soon be somewhere toward 95% approximated immunity. It's going to take a little time, but when you add children who will be able to get vaccinated in a couple of weeks, 5 to 11, and all these other individuals who either caught COVID and their support could get a doctor's note or just plain got vaccinated, most of the state will be in the clear, and so I don't think cards and passes are going to even be necessary. We'll see, but I know that really is a concern for some people. Even certain subcultures have been very reticent to have to show a card.
Yeah.
And I understand that. We're trying not to draw distinctions between people of heartfelt different ideologies. We have to make good public health decisions, but we should not be a police state. We should really be kind and thoughtful about this whole process, because from my perspective, and I know we're running short on time, as a doctor, people went through a lot, whether they had COVID or they had to deal psychologically with the isolation and just the extra rules to navigate. And we have to gradually return to normal. We have to return to social norms and economic norms. And I don't think flashing a vaccine card is normal for most people. So we'll get there. I just am grateful to people for having made their commitment to safety.
That's a great ending point. Lieutenant Governor Green and Josh, thank you so much for joining us this morning and sharing this. I love hearing that we're moving in a positive direction. I love hearing that, again, that as we get there, we can to get back to more normalcy and eliminate the need for those passes, and that it's coming. So we want to give everybody hope. It is coming. Things are starting to move forward. We're 2 weeks to 4 weeks out, and we'll just keep watching it. But we can still work on, again, wearing the mask, social distancing, washing our hands, being safe.
All those things matter, and I'm really proud of people. So, hey, thank you for including me, and hopefully we'll be able to have a wrap-up of this COVID pandemic sometime on the radio in the next couple months.
I look forward to that. Okay, we'll have you on again soon. You have a wonderful day.
You too. Take care.
Thank you. You too. Aloha. We'll be right back after a message from our sponsor, Mokulele Airlines.
Mokulele Airlines operates the largest commuter airline hub in the country, right here in Kahului. Fly Mokulele from Kahului to Molokai, Lanai, Hana, Waimea, Kona, and now Hilo. Mokulele also operates the only flights between Kapalua and Honolulu. There is never a middle seat on Mokulele, and every seat has a window and aisle. Visit mokuleleairlines.com and take your next flight from the newly renovated Mokulele Terminal.
And we're back, and it's my pleasure to welcome the Executive Director of the Hawai'i Restaurant Association, Sheryl Matsuoka. Sheryl is a local graduate of Kalani High School, happily married and a mother of one. Her professional background includes National Utility Contractors, Honolulu Executives Association, Hawaii Jewelers Association, and Toshiba Business Solutions. Good morning, Sheryl, and welcome to the show. Mahalo for joining us again.
Good morning, Pam. How are you?
Thank you. I am excellent. How are you today?
Thank you. Well, it's been very busy for restaurants, as you know. This has been a really challenging time for us.
Yes. Let's talk about that. I know one of the big challenges that we've been seeing in many of our businesses is some of the cancellations after the after the governor's message. You know, as he was looking at the hospital capacity and the intensive care units filling up and more patients, he shared a message that it was a risky time to travel. How have the restaurants fared during this time?
You know, we understand why Governor Ige made that announcement because, of course, our COVID positive case counts were up and the hospital bed limitations. We understand, you know, all of that. But right now, restaurants are reporting on the average, they're down compared to September of 2019. Because, as you know, 2020 is a wash. We don't even look at 2020.
Yeah. Sadly, yes. Sadly, yes.
It didn't ever happen. So compared to September of 2019, our sales are down 40 to 50%. And I also have reports of some smaller restaurants and businesses that are losing up to 70% in sales compared to September 2019. And, you know, it was part of that, you know, but it's also, I think, the perfect storm where right now, because of international travel and the restrictions in Asia, our Asia visitors have not returned.
Right. Yeah, and that's, you know, I'm glad that you brought that up because that's another key thing. So many times we talk about the domestic travel, but looking at the international travel as well and the impacts of that.
Exactly. And what happens normally is, you know, we're in that shoulder period and September is one of those months. But even when, you know, all of our domestic travelers go back and everyone's back in school, it's our Asia visitors, you know, our international visitors, our Canadian visitors that support during this time, and they have not returned. So the perfect storm is, number one, of course, you know, we're dealing with the pandemic and all of the restrictions and mandates. Also, our international visitors have not returned. So Hawaii restaurants are really feeling it.
You know, and they have, and as we've seen some of the restrictions ease, they were starting to gear up and starting to try and bring people back, and we had worker shortages that was, you know, hampering them being able to bring workers back. And now we're kind of, you know, going back to some additional mandates, and you folks represent both restaurants on each of the neighbor islands, and then you represent some of the larger restaurant groups that have chains that might have restaurants on the different islands. I'm wondering, Sheryl, how I mean, you guys are, it's a lot to take in. I'm wondering how the restaurants are doing with the different mandates, and for some of those chains, how, if they're feeling that one particular island's mandate is better or worse than another.
Yes, the restaurants definitely had to figure out what works on, you know, right now Maui has the safer outdoors where unvaccinated guests may, you know, dine on an outdoor open air dining room. And it's not only for the restaurants, but Pam, it's also for the visitors who maybe land in Maui first, and the visitor is unvaccinated and they're enjoying, you know, the beautiful palmy weather and dining outdoors. And when they come to Oahu, they're like, you mean we can't come into a restaurant even though they have, you know, basically, you know, an open air lanai. So it's not only the restaurants that have to adjust, it's also our visitors.
Good point.
Who travel between islands. And they have to also know that each island has different restrictions. So we're hoping, you know, that our mayor on Oahu, Mayor Blangiardi, you know, allows us to have outdoor dining for the unvaccinated. We're hoping that happens. And then that way it's more consistent across the island.
Yes. And that's been something all industries have especially those connected with the visitor industries. Not all industries, because there's many who have still done very well during these COVID times based on the type of industry they're in. But those who are connected with the broader visitor industry have shared, their guests really struggle with the different mandates between the different islands. And so
exactly, and it's confusing for them. They're coming from a state that maybe they don't even have to wear masks,
right?
And they don't understand that they have to show a vaccine card and an ID when they come to a restaurant, and we're asking them for their card. So it was really difficult, even for locals. You have to know that
right.
We have some situations where our local guests, they're like, "What are you talking about? We don't really watch the news, and we didn't hear about this." And the wife has a purse, so of course she has her vaccine card in her purse. And the guy's like, "No, it's too big for my wallet. It's bigger than my pocket, so I didn't bring it." And then they at least have an option to take out. So
yes.
It's educating. That first week or two was educating, and now we're seeing more people, especially the locals, understand that what the mandate is, that if you want to dine indoors, you have to have a vaccine card or upload the Safe Access or and show an ID at the same time.
Well, and I'll tell you, this happened to us, and I was going to say, or take a picture of your vaccine card and keep it on your phone. I had done that with my other half when we were traveling, and thankfully after the restaurants reopened, we had a celebration, and so we went to the restaurant, and of course, the minute they got there, I spend my days and at the chamber, Amber, my office manager who does a lot of e-blasts and getting these words out. So I knew and should have been very well prepared to make sure that I had my vaccine card in hand when I walked up to the front of the restaurant. But I did have to dig in my purse, and of course, I had mine. But my other half was like, "Oh my gosh, I'm going to have to drive home." And I kept saying, "Well, wait, we did something. Wait, I know we took pictures of it." So sure enough, he had to go through, 100 photos on the phone. But anyway, sure enough, we had a picture of the vaccine card on the phone.
Thank goodness.
So we also encourage that because that and your ID will be a tremendous help. Or, again, going to the Safe Travels program. It's a quick upload. We want to see people do that. But what I will say is I think the restaurants are really doing an amazing job. Some are still temperature taking. And, we're used to that. So it doesn't, I think that that's great. They're still taking temperatures. And we're also used to that anymore now that, it doesn't even affect us. I remember one time, someone said when they wanted to take the person's temperature at their forehead, the person said, "That's my third eye. You're not able to take my temperature there." And so now we've moved to the wrist. So it's very simple. They can quickly take your temperature on your wrist. And you just have to have either the card in hand or upload it to Safe Travels or a quick JPEG on your phone. Will make it a lot easier. But again, the social distancing and the cleanliness and all of the hand sanitation places that you can, when you enter the restaurant, you can quickly do a quick squirt and clean your hands and make sure that you've done that. It feels, it's comforting. I think it's comforting, and they're doing it in such a great way. But I totally hear you that, again, if we can align some of these mandates so that when people travel from region to region, we can pick the best practices. And if we pick the best practices that are working and working safely, why not institute those things statewide?
And we also have visitors, when they come in, we have to do contact tracing.
Yes.
And so we have to ask our visitors and our guests, for their information. And sometimes, they look at us like, "Why are you asking me for this?" We're required, by the Department of Health to do contact tracing. And they're like, "What is that?" It's like, and we explain it. So you're correct. A lot of training. Our frontline hostess, our frontline greeter, our servers, they all had to be trained on all these new protocols and go through, we have scripts written. A lot of them also have been through de-escalation training.
Yes.
So when somebody isn't happy about, showing an ID or, if there's confusion, then they have to realize that this is not a guideline or mandate that was set by the restaurant, but this is a government. a government mandate.
First of all, I hadn't even thought about that, but think about that, folks. How sad is it that we're here in Hawaii, where we embrace the aloha spirit, we're having to train our frontline workers on de-escalation practices. And we're seeing this growing frustration. But again, that helps. I mean, with knowing that helps. And, it really, the staff is doing an amazing job. And I think it's so great that people remember, again, this is not the restaurant's mandate. They're following the government's mandate. And in many cases, that was helpful to some of the restaurants, because I remember many restaurant owners saying, look, it's not my personal belief that people get vaccinated. Personally, I do recommend vaccinations personally, but I understand others said, hey, they didn't feel like that was their role or something they wanted to do. And when the government came out and set that standard, now it's a government mandate. It's not the restaurant. The restaurants are following the required government mandate, and that's really important for people to recognize.
Exactly. It's very important. And, we appreciate our community understanding and supporting, their favorite restaurants, because if there's ever a time, Pam, where restaurants, again, need our community support, it's now. Without our international travelers and domestic travelers, it has been really difficult. I've heard, and, I haven't been to Maui recently, but I have heard it's pretty empty and pretty lonely over in like Lahaina and places like that.
Yeah, we are getting back to that. There was a time just over the summer where, locals couldn't even get back into the restaurants because everybody was slammed and reservations were really hard to get. But, in this shoulder period, we are seeing things again open up. So I appreciate that, Sheryl. This is a great time. We always say shop local, dine at our local restaurants. This is a great time to remember to support them, a great time to get back into some of those favorites that maybe you couldn't have gotten into over the summer. What are some of the other key things that are needed to support your members?
Really, if you have a birthday or a celebration, if you could support the restaurants by purchasing a gift card, that would really help us, because right now we're seeing that it's been very challenging without our local community or people who are unvaccinated. Many of the restaurants, as you know, even on Maui, have gone to takeout models.
Yes.
So just supporting by ordering takeout, a gift card, and visiting your favorite restaurants, because you don't want to see it closed up. We're hoping that things get better soon, right? And some of these mandates are lifted in a few weeks. Till then, the restaurants have to pay their rent and pay their employees, and they don't want to lay off their employees, Pam. The employees are counting on that medical coverage. So they try to, figure out so that everybody can have shifts and hours so that they can qualify for medical. And that's a key when you want to maintain excellent employees that have been with you for a long time.
That has been the biggest thing I've heard from the restaurants is, they've just been struggling to keep their excellent employees and trying to bring everybody back. And how are they doing, in terms of testing? Are many of them instituting the smaller ones that are not federally mandated? How are they doing in terms of the testing mandates, and are we seeing more of that?
Yes, we are. Luckily, we've seen more testing sites, and that has really helped. And the last governor's proclamation, allowed for the employer not to be responsible for the testing. So now the employees are going to the free testing sites, which are way more readily available now than it was in the beginning of the mandate. And employees, especially so the ones that I know, they have to turn in all their negative tests by early Monday morning. The clock starts at 8 o'clock. So please turn it in before 8 o'clock. Upload it so that we can do your shift assignment for this week.
Yeah.
And that's been working, and people have been doing it. And I've also heard that because employees now are saying, oh, gosh, this is really kind of humbug, so why don't I just go get vaccinated? So I've heard that is also happening. More people are saying, humbug, so let me just go get vaccinated so I don't have to go through this.
Yeah, and I was on a forum the other day where we were talking about this, as were you, and I think Wendy Laros from the Chamber of Commerce of Kona Kahala was saying, that again, it's okay to change your mind. And so some people we've seen have been changing their mind. The testing is kind of humbug, and they have said, you know what? They're learning more, and as they were getting tested, we've heard stories where they were talking to some of the nurses administering the test, and they said, you know what, I think I'll do it. So that's good to hear as well.
Yes, that's what I'm hearing. And then the restaurants are reporting back higher percentages of vaccinated, which is a great thing, and the community can be rest assured that restaurants are number one, if they aren't vaccinated, testing them weekly. And so that assures our guests and patrons that it's a safe environment to come in.
You folks have been leading the way, working on how to operate safely, and we so appreciate it. Sheryl, thank you so much for the update this morning. It's always great to have you on the show.
It's always great, Pam. Anytime, just let me know, and you be safe and take care. And thank you to the community for all of their support. The restaurants really appreciate it.
Thank you. Yes, let's get out and support the restaurants. Thank you, Sheryl, for all you do, and we'll look forward to having you again. Take care and be well.
Anytime. Bye-bye.
Aloha.
Mokulele Airlines operates the largest commuter airline hub in the country, right here in Kahului. Fly Mokulele from Kahului to Molokai, Lanai, Hana, Waimea, Kona, and now Hilo. Mokulele also operates the only flights between Kapalua and Honolulu. There is never a middle seat on Mokulele, and every seat has a window and aisle. Visit mokuleleairlines.com and take your next flight from the newly renovated Mokulele Terminal.
And we're back with Ross Scott, owner of Sunshine Helicopters, who has been a longstanding member of the Maui Chamber of Commerce and doing such amazing things in our community. Welcome, Scott, to the show.
Hi, good morning.
Good morning. Can you tell our audience a little bit about Sunshine Helicopters, how you got started, and any kind of changes that you folks were making throughout this COVID pandemic?
Well, we started Sunshine in 1985, so we're in our 36th year now.
Wow.
We grew from 2 leased helicopters to 10 helicopters. We expanded to the Big Island from Maui in 1998, and in 2006 we expanded over to Kauai.
Oh, my goodness.
So we never moved to Oahu, and we've kept all of our operations on each island fairly small, maximum 3 helicopters.
Oh, okay, great. So I love that you've expanded, but each of our neighbor islands has a very small operation. I know that the operation here is very responsive to their customers and offering amazing tours. Can you tell us about the different tours that you folks offer?
Well, each island, of course, is different. On Maui, we have 2 primary tours. It's the Hana Haleakala, and it's the Molokai tour. Both of them are terrific, actually. Molokai has, on the north face there, 3,000-foot cliffs all the way from, with waterfalls from the top to the bottom. And, of course, Haleakala and Hana are incredible.
Yes.
The other islands, we basically only have 2 tours on the Big Island and 1 tour on Kauai.
Oh, awesome! And what do you see on the Big Island?
Well, the Big Island, the big draw, of course, is the volcano, and it's being active right now. And we do not operate out of Hilo. I did at one time, but we only offer tours from Waikoloa, Mauna Kea, over to the lava flows.
I bet the tours are completely booked for the volcano right now.
Yes, it's very popular, and it's pretty spectacular. Even having done it for 30 years, every time I go, it's awesome.
I'm watching it on the news every night, and I'm envious of those who get to stand by and watch. I'm one of those people who has allergies and asthma issues, so I couldn't be on the ground. But a helicopter tour sounds perfect for me.
It's pretty awesome. It's like a magic carpet.
Yeah. Oh, I just love to go on helicopter rides. So how exciting is that? And how have things been going over this kind of shoulder period? What has happened with your bookings? Has everything been steady? Have you seen some drop-offs?
Oh, we were totally shut down. In fact, in March of 2020, on the 18th, I decided to cut back on operations on all the islands and not do tours for a couple of weeks till we see what this COVID thing was going to do. Yeah. And the next day, the governor shut everybody down.
Yeah.
So I just, and then we didn't fire back up until May of 2021. So we had no revenue. We went from 95 employees to none. When we fired back up, we're operating on all three islands again, with 2 helicopters on Maui, 1 on the Big Island, and 1 on Kauai, and we're back up to about 50 employees.
Yeah. Did you folks, after the governor's message on August 23rd, did you folks see cancellations come in as a result of that?
Yes, not only cancellations, but also we had a number of, our level of bookings dropped off tremendously. I mean, it was like 50% drop in new bookings.
Wow. Okay. Yeah, we've been working with businesses who have been, tracking that, because I think it's important to also, as we've been talking to people, we've been working with them to say, okay, well, some of the cancellations or new bookings that are dropping off, is it because at one point, just prior to the governor's message, our case counts were rising. And then the governor's message, we understand why he did it and that he was trying to be helpful. And but then we saw a drop-off with bookings and cancellations. Were you finding before the governor's message, were you seeing a drop just because people were afraid of the COVID case counts rising?
No. We were doing extremely well, I thought. With just 4 helicopters, we were doing half the revenue we were doing with 10 helicopters.
Wow.
I don't know. The state seems to be on the wrong track here, because the COVID cases are falling off. You look at the football games on the national level, and the stadiums are full with people not wearing masks, and there's not being big outbreaks. Having said that, Hawaii is a really safe place to come, and that's why I think the helicopters are doing so well. It's not just my company. All the helicopter companies have rebounded, and they're real close proximity, but everybody's been either vaccinated or they've had their tests for negative. Mm-hmm. And I know of nobody that's gotten sick from riding on our helicopter.
That's awesome. That's great to hear. Are you still allowing corporate groups to come in and doing some special events and private charters?
We do, and the corporate stuff has dropped off quite a bit for us.
Okay.
And what we do a lot of is transfers. We transfer a lot of celebrities and folks over to Lanai or to Hana.
Okay.
And we do an occasional transfer over to the Big Island. It's really quick. 30 minutes. They arrive at our place and they arrive at their hotel on the Big Island. And on Lanai, that only takes like 15 minutes.
Wow. A quick trip over. Yeah. Without the tour. How long, given that those quick hops to transfer, but good to know. I had no idea that you folks did that, so that's really nice to know. How long are the tours generally?
Our tours are from 45 minutes to about an hour and 10 minutes. The 2 popular tours on Maui are 45 minutes each.
Okay.
Big Island is a longer tour because it goes from one end to the other, but it's beautiful over there. and Kauai is right at an hour, 55 minutes actually.
And how many people can actually sit in the helicopter?
Well, we seat 6 passengers, and we invented the first-class seating for the people in the front seats.
Uh-huh.
It's a little more space, and of course you get an unobstructed view. But the helicopters that we fly, the Whisper Stars, the back seat was designed for tours, and it's elevated about 6 inches above the front seats so that the passengers in the back on the Whisper Stars have an extremely good 180-degree view also.
Oh, that's awesome. Yeah, for those who haven't been in a helicopter or done a helicopter tour, it's such an amazing thing. Particularly, I don't think I ever had the luxury front seat view, but I always had a great view. And just, the photography that you can take, and it's just amazing to see things on your island that you would never see otherwise. And to get that upfront experience where you're maybe going into areas that would be very dangerous to even hike into, you get to be up close, and it feels very connected when you're there, and just you're in awe. It's a really amazing experience to see the beauty of our island in that way. So Ross, tell everybody about where you're located and how people can learn more about Sunshine Helicopters or book a tour.
Well, the easiest is our website, which is www.sunshinehelicopters.com. When you that'll pull up all 3 locations. On Maui, we're at the Kahului Airport, at the heliport on the opposite side of the main terminal. On Kauai, we're at Lahui Airport. And on the Big Island, we're at Mauna Kea Resort, back behind the golf course up on the mountain. Wow. It's beautiful up there. It's got the best view of the whole resort is from our heliport. And we have on our website, there's phone numbers for all of our reservations and groups and charters, and all the information is available there.
Well, it sounds like this is a great time for people to come out and take a tour with Sunshine Helicopters. You've got multiple tours available for Maui, and we thank you for sharing those with us.
Okay, well, and I also want to remind the Kamainas that we have a substantial discount for Kamainas, and when you fly and observe the areas.
Ross, I'm sorry, we're gonna have to direct them to the website for that because we've got to go. But thank you so much, and have a wonderful day. And to everybody listening, we wish you a beautiful Maui day as well. This is the Business Matters radio program, sponsored by Mokulele Airlines and brought to you by the Maui Chamber of Commerce. I'm Pamela Tumpop, the Chamber President, wishing you blessings and best wishes for a beautiful Maui day.